Hello. The focus of this video is domestic and economic policy. Please make sure you read chapter 13 in the book. So the topics that are covered in chapter 13 include how we formulate policy, domestic policy in the United States. Domestic means internal policy within the country. And in the next chapter, we'll get into foreign policy, which involves our relationship with other countries. But domestic policy refers to how we deal with things in the United States. So it could be economic policy is very much a part of that, but also policy about education or healthcare, immigration, a number of other topics that are covered in that chapter. And there is a discussion in the reading about the policy process, how policy is formulated. One thing to understand about public policy in the United States at the federal level is that Congress, of course, is very much involved because the vast majority of public policy requires legislation, it requires laws, and so that's the responsibility of Congress. But of course, the executive branch, led by the president, is also important because that's the part of our government that carries out the laws. And the executive branch also does have some ability to implement policy as it sees fit. Now, sometimes there can be a conflict between what what the president sees as fit and what Congress sees is the right thing to do. And so those conflicts can sometimes arise, and if there is a conflict, it would go to the Supreme Court. But most of the time, if the president issues an order or carries out a policy in a certain way, that it's accepted that that's what's going to happen. In terms of some of the issues that are discussed in Chapter 13, there is a focus on a couple of very important domestic policy issues that have been in the news a lot in recent years. One is healthcare. Healthcare has been a major issue in this country for multiple decades. We are one of the few advanced industrial nations in the world, maybe the only one that does not have a government-provided healthcare system. Our healthcare plans are primarily private, which means that most people who have health insurance in the United States get it through an employer or a private health insurance company. Now, there are government plans. For example, Medicare was created in the 1960s. Medicare is a government-provided healthcare plan for senior citizens. People who are 65 or older who have paid into the system are able to draw benefits once they hit that age. And it was a major step forward in terms of healthcare in the United States back in the 1960s. We also have what's called Medicaid, which is a government health insurance program that is a partnership between the federal government and states to provide health insurance to low-income families. And Medicaid has been expanded fairly significantly in the last number of years as a result of the Affordable Care Act, which I'll mention in a second. But again, even with those government programs, there's also the Children's Health Insurance Program and a couple of other examples. Again, most healthcare benefits are provided through employers or in the private marketplace. Now, the good news is the vast majority of Americans do have health insurance. The bad news is that we do have a number of people who do not have health insurance. We have more people without insurance than any other country in the world, any other advanced or industrial nation in the world. And that's because we don't have a system like Great Britain or Canada have where the government actually provides the health benefits. Canada and Great Britain and a number of other countries have what are called single payer systems where the government just provides the benefits. So as a citizen of that country, and even as someone who's visiting that country, you automatically have the right to get health insurance or health benefits at minimal or no cost to you. Now, it is paid for through taxes, so ultimately, if you're a citizen of that country, you're paying for it through your taxes. But it is guaranteed coverage, and in those countries, 100% of citizens have health benefits. In this country, the percentage of Americans without health benefits has varied over the years. It's been as many as 15 or even 20% of Americans. Today, it's less than that, but it is still more than 10% of Americans do not have health insurance, and you're talking about millions of people. In 2010, Congress passed what was called the Affordable Care Act, which is still the law today. A lot of people refer to it as Medicare. I'm sorry, a lot of people refer to it as Obamacare. Medicare was a previous law, but Obamacare which is a system. It was an effort to fill in the gap, so that recognizing that a lot of people could not afford health benefits and weren't getting benefits through an employer, they could get health insurance through the Affordable Care Act. Essentially, what the Affordable Care Act did is it set up insurance exchanges where people without benefits could purchase health care on a market, and the idea was that the plans that you could get on the market would be cheaper than if you're just trying to do it on your own without any market whatsoever, because buying insurance on your own can be very expensive. And the Affordable Care Act also provides subsidies to people who fall below a certain income level, so that if it's going to be overly expensive and for a person to purchase health insurance, and they're not getting it through Medicare or through an employer, then they can get it through the exchange. Now, again, keep in mind the vast majority of Americans are not participating in these health insurance exchanges because they already get health benefits through an employer or through Medicare or Medicaid. But the exchanges are designed to fill in a gap. The exchanges first went into effect in around 2014 and have been in effect ever since. They've been very successful in terms of improving access. The percentage of Americans without health insurance has gone down significantly since the Affordable Care Act was passed. It also expanded the Medicaid program so that Medicaid was available to a larger number of people. But that required, because of a Supreme Court ruling, the expansion of Medicaid only applies to states that voluntarily agree to expand the Medicaid program in that state, because the state is also providing money for it. Many states have expanded their Medicaid programs. In fact, more are considering it right now. And the state of Michigan is one of the states that did expand our Medicaid program. So the combination of expanded Medicaid, the insurance exchanges, the subsidies, all of that was designed to try to reduce the cost of insurance to people who could not get it, who were not getting it through an employer or not getting it some other way. Again, there have been a lot of criticisms of the Affordable Care Act, arguments that it did not reduce costs by as much as people thought it would. And then, of course, in the Trump administration, there was a serious effort to abolish the plan. And the Republican Congress at the time was almost successful in doing that, but ultimately the United States Senate decided not to abolish the Affordable Care Act, and so it is still the law today. The Supreme Court has looked at this plan several times to decide whether it's constitutional, and each time thus far that they've ruled on it, they've ruled that it is constitutional and have allowed it to remain in place. It's possible in the future. There are still some efforts to have the court strike it down, but as of right now, the Affordable Care Act is still the law of the land, and many people are participating in it. But again, there continue to be arguments about what we should do, because there are still a large number of people who do not have health insurance, and no matter your age, no matter where you live, no matter who you are, eventually in your life you're going to need health insurance, either because of an emergency or an illness, or just as you age. There isn't a single person who lives who can avoid going to a doctor or a hospital at some point in their lives. A lot of times younger people think that it's not necessary to have health insurance because they're healthy and they can just wait until they get sick, but the reality is that we all do need health insurance. And so again, there are ongoing battles in Washington, D.C. about how to deal with this issue, how to provide health insurance, how to make it affordable. There are some who believe we should have Medicare for all, where everybody would get government-provided benefits, but that would also require a significant increase in taxes, income taxes, and so forth. And the question is, would people be willing to pay that? Keeping in mind that if we had universal coverage, then you would not have to pay for health insurance through an employer or some other means. You would just get it through the government. But at the moment, it doesn't appear that there's enough support to pass a Medicare for all plan. There are also discussions about expanding the Affordable Care Act or lowering the Medicare age. Right now it's 65. There's been discussion about whether it should be lowered to 60 or even 55, which would allow more people to get Medicare, or to have a government plan included in the insurance exchanges under the Affordable Care Act. And this is one of the areas where having different presidents can have different philosophies. Under President Trump, there was an effort to do the bare minimum on the Affordable Care Act, because President Trump did not support that law, and he was trying to get it abolished. He wasn't successful in that, but he did kind of the bare minimum in terms of promoting the exchanges. Under President Biden, there's been a significant effort to promote the exchanges. Of course, President Biden served as vice president under President Obama, and so he did see the value of the Affordable Care Act. He supported it very strongly, and so as president, he's been promoting the exchanges, opening them for longer periods of time for enrollment, so because of COVID and other reasons, so that more people can participate. And the number of people enrolling in the Affordable Care Act has increased since President Biden took office. So again, healthcare is an ongoing discussion, an ongoing debate. It's not going away. There can be arguments about whether we should have a government-provided plan or be largely private as we are right now. But the reality is insurance is much more expensive in this country than it is in many others, and we simply don't have universal coverage as many countries do. So it's a debate. People have different opinions, but the reality is that we just simply do not have universal coverage in this country. So that's the topic of healthcare. In a separate video, I will discuss a couple of other issues with regard to domestic or economic policy, but that is it for this video. So if you have any questions, email me, and I will see you in another video. Take care.